Welcome back to Balanced Health. The recommendation of joint replacement surgery usually provokes questions like, will it be painful? Will my recovery be lengthy? And will I need long-term physical therapy? Yet for younger active adults, the news that they need hip or knee replacement surgery is met with another critical question. Will I be able to continue pursuing my athletic interests? Well, Dr. Vineet Shah is here to answer those questions and others that you at home sent in, and we're going to get to some of those in a minute. Shall we show these beautiful joints here which was very fascinating for me because I've always wondered what they exactly look like. My dad had hip replacement surgery 20 years ago, and there's been a lot of advances. In fact, we were going to talk about that.
Yeah, let's start and tell us what we're looking at. What are we looking at?
Let's start over here on the component right next to you here. This is a representation of a knee replacement.
Okay.
And in a knee replacement, what you see is that the femur or the thigh bone is replaced. The end of it is cut appropriately and replaced. Similarly, on the bottom here, the metal component here for the tibia or the shin bone is cut, made a flat surface and replaced, and a polyethylene piece of plastic is appropriately placed in there to replace the meniscus or the cushioning cartilage that used to be there. In addition, one component that's not on the model here is the kneecap. The undersurface of the kneecap, which has arthritis, is also cut flat, and a plastic nubbin type button is put on there.
No, it sounds painful. It just sounds painful.
Can that vary once you get in there? Can this cutting away and how much you have to do with it, can that vary once you get in there? Is it pretty standard? In other words, can you find out that there's more deterioration than maybe you would have thought? You got to keep cutting to get a clean surface to put this new baby in?
There are times that has happened. You know, in my experience, there are times, a lot of times the x-rays give us enough information to give us a good idea as to what you're going to see, but we have to be prepared for everything. Sometimes you see bone loss in areas where you don't expect it, so you should be ready to rebuild the joint. And the key thing in this type of surgery is to balance the knee, the ligaments, the bone. It's not just bone cutting and putting components, but making sure that the individual's leg is well balanced, ligaments are appropriately balanced, and that they can move like they would like to.
You have to really know what you're doing, and I want to say that Dr. Shah is one of the most well-known, one of the greatest experts in this area, in this whole region. At least that's what we've heard. So we're delighted.
For smart people.
Yes, thank God for smart
here
people.
We're looking at
and talented people.
This is the hip model, and this is to keep in mind of a simple thought process of a ball and socket joint. This is the ball and socket. Yeah, this whole overall is the pelvis bone. This is the thigh bone or the femur. We work inside here and create within the socket of the acetabulum, as it's called, a metal component is placed in there and a plastic liner. And in the similar way, in the thigh bone, a pin or a stem, and the femur and the ball right here is what replaces the actual ball and socket.
Incredible.
And so we're talking about most of their bone around this is intact. You're making it all work together again.
Exactly, and keeping all their ligaments again in the hip, the soft tissue, protecting their nerves, taking care of their muscles, and making sure that their ligaments are all nice and appropriate, so they don't dislocate or have any complications because of that.
So we touched earlier about when to get joint replacement done, and I think that our viewers are probably clamoring now, watching this, saying, you know, here's my situation, would it be too early for me? We look at the whole picture and we say that you'll get quality of life quicker if you do it earlier. There's a couple other things I would like you to comment on. Are we seeing materials that last longer, which would be another reason to do it earlier?
Do they last?
And are we seeing any change in the amount or the degree of invasiveness in the surgeries, which would be yet another reason to do it earlier?
In terms of the materials, absolutely there's a constant progress. Within the hip, the plastic liner, for example, is made out of polyethylene. And over the years, the quality, the ability for its longevity has improved tremendously. We also are now doing ceramic against ceramic in the hip, ceramic against plastic, metal against metal. These different variables are within the hip. Within the knee itself, it's still metal, plastic, metal interface. But the quality of the components are increasing. The bearing surfaces are increasing, and that has been to much of our advantage, so that we're hoping that these joints are lasting longer than the 10 to 20 years that is often quoted.
So maybe you go to 20 or 30?
You know, I've seen outliers even from cases done many years ago. Obviously, it's up to 30, 35 years, but those are very much the outliers.
Is there any way to tell in a patient if that individual has a better chance of having their replacement material last longer? Are there any, other health factors that you look at and say, the average is 18, but I think in you we can get 25?
Obesity would be
absolutely.
one of the things, right?
So otherwise healthy is a good indication.
Healthy, lightweight, active, good muscle structure, good strength, that's all important. Obese patients are the ones that will wear the joint off more frequently, and in certain bearings you have to be careful in terms of any damage if they're athletic, extreme sports after having joint replacement. Those are things that need to be maybe toned down a little. Still do what you like to do,
right,
but just modify it.
Use common sense.
Yeah.
And what about the minimally invasive? That was one of our questions actually from one of our viewers was what are the pros and cons of these minimally invasive?
Minimally invasive surgery has come to the forefront in the last 3-4 years more so, and the idea behind that was to try to accomplish the surgery having a smaller incision with the goal of hopefully less blood loss, better cosmesis, and less pain.
And chance of infection too?
Not necessarily. In our societies, in our hip and knee societies, there's a lot of debate and controversy about that. And in my opinion, it is important to try to provide a surgery where you can get the implants appropriately in the right position.
That's the priority.
That's the priority.
And these are some of the cons about these minimally invasive that we see in the research that's coming out in the data, is that component malposition, fracture while doing surgery, because you're trying to put components that you can see the sizes. These are pretty representative of average or even small sizes. They could be bigger. In the hip joint with tiny incisions. Cosmesis, it's like a bee sting. On the surface, it's a small little sting, but you don't know the damage that you do underneath this. One of my mentors used to say that, underneath the skin. It's the same thing. You have to pull and prod to try to get these components in.
Right.
And minimally invasive surgery, people that market it and talk about it should be surgeons that are well trained in it.
I could hear you saying that it's not necessarily, so there may be too much marketing. We have about 45 seconds left. I wanted to touch on this. When a patient has joint replacement, I remember when my dad had his knee replaced. After the knee was replaced and he got through the period of no infection, the doc said, okay, the rest is up to you. They really have to dedicate themselves to rehabilitation, don't they? And you will see a varying degree of success based on their efforts, right? We have about 30 seconds.
Absolutely. I try to start off right from the first time we talk about joint replacement. I like to see the commitment of the patient.
Right.
I invite the families. It's not about just the patient and the doctor. You have to involve the families. It is a group effort, but they have to be committed. They have to want to get better.
And it does hurt.
And it hurts, but there are great pain management techniques now.
I think it's worth it. My father's life was changed. He got his golf game back, and to him that was everything.
Thank you so much.
Well, if you have any health questions, email them to balancedhealth@tln.com. Also, remember to call 888-242-9393 for a copy of today's show. I'd like to thank Dr. Vineet Shah, an orthopedic surgeon from Dreyer, who is fellowship trained in hip and knee replacements, for joining us. Visit tln.com, click on shows, and then Balanced Health. We'll be right back with your healthy habit of the day. Don't go away.